Hi everybody, my name is Carl Bonnett. I'm the medical director for Klarisana. I want to make a video talking about how ketamine works for the treatment of severe depression, PTSD, various mood disorders. A number of folks would argue that ketamine is purely a biochemical process. It hits a number of receptors and causes a response, causes the synaptogenesis and whatnot, and that's all there is to it. It's simply just a matter of hitting the right receptors, you can get the right response. I would argue, and what our experience here in our centers has been, is that the experiential quality of ketamine is also vitally important. That the feelings that you get during the experience of the whole process of getting the infusion is also a part of how it works. And that's what I'd like to further clarify in this video. And we're going to introduce the concept of what we call the Psychotropic Therapeutic Response, or the PTR. Okay, so what is the PTR? The PTR is the Psychotropic Therapeutic Response. And that's a term that we came up with to try to explain what it is we're going for. What are we trying to achieve? Now, many folks would argue that the experiential changes that you have with ketamine, the alterations in visual and auditory perception, are side effects. They're things that we need to get rid of, that they're not helpful, if we could just get rid of those, then it'd be great, because then the ketamine could just hit the receptors, do what it needs to do. Now, I would strongly disagree with that. Back in early 2015, when I got the idea to open the clinic and start offering ketamine therapy, I was fortunate enough to get connected with Dr. Phil Wolfson and Dr. Terry Early, both practicing in California, and they are psychiatrists who helped really sort of help me formulate how we were going to offer ketamine therapy and what our treatment paradigm would be. And they're the ones who really sort of got me turned on to the idea that the experience is actually very, very important. The way you want to dose it in such a way that you do have a powerful experience. So as I was kind of trying to wrestle with this and get my arms around this concept of like, well, how do we achieve, what is that point? What are we trying to do? And I was working with my staff on this concept and trying to figure out how we're going to articulate this. And we came up with the term the Psychotropic Therapeutic Response, the PTR. So this would be the target point that we're looking for with our patients. And for everybody, that's very different. In some people, it might be 50 milligrams over an hour. In other people, it's 150 or almost 200 in some patients. It all kind of depends on the metabolism, depends on the way the patient wants to experience it. Some people, they just want to have a little bit of a less intense experience. Other people want a much more powerful experience. But the point is that the experience, this is what helps break your mind out of some of the paradigms that you're in. And many of our patients report that is incredibly important, that that change in perception allows them to think differently, allows them to get into a different space and think about their problems and think about things in a different fashion. The thing that can be a little bit frustrating for some clinicians and some people to wrap their arms around is when we talk about the PTR. It's a very unique situation in medicine, because many things in medicine, it's all based on a weight-based formula. If you have a severe infection, I'm going to give you a certain number of milligrams per kilogram of an antibiotic. If you're an anesthesiologist and you want to anesthetize somebody in the operating room, it's a certain number of milligrams per kilogram. So when I talk to other clinicians and they ask, well, how do we dose it? How do we do this? How do we achieve the effect that we want to achieve, which was what we call the PTR? The problem is there's not an easy weight-based formula, because we're trying to find a mental headspace here, if you will. So that is not necessarily, I can't say it's just, it's 1 milligram per kilogram or 2 milligrams per kilogram. It's very, very different in every person. And that's why it's kind of fun, but it's also a little bit more tricky, because we have to find that in people. And over the course of the 6 infusions, we actively work with patients to try to guide the dose in a dynamic fashion to get to the point where we found their PTR. So, one person's PTR will be very different than another person's PTR. And it's not necessarily based on the size of the patient. I have some adult males who want 50 milligrams over an hour, and that gets them in a good space. I've got one petite young lady who I see who we give her 200 milligrams over an hour. And for her, that gets her to a good space. And it's very, very individualized. Now, the thing to keep in mind is, of course, remember, this is an infusion over 1 hour. So again, there's some naysayers out there who say, oh, you're giving it, ketamine in the outpatient setting, and this is, anesthesia and whatever. No, this young lady who I was talking about who gets 200 of ketamine, listens to her music, she's conversant, talks and whatnot. The point here is not anesthesia. We're not trying to do moderate sedation. This is, psychotropic infusion therapy when we use it for mood disorders, mental health conditions, and whatnot. So the patients are conversant, interactive. We offer facilitated psychotherapy where a therapist can work with them during this period. So the PTR is by definition a point where the patient is reactive, responsive, able to follow basic commands. They're definitely having a powerful experience, don't get me wrong on that, but it's a very unique space that we're trying to get them into. The other thing with ketamine when we're trying to achieve this PTR is we have to try to explain to the patient ahead of time what we're looking for. In the whole process, the patient is our partner in terms of trying to figure out how to achieve this PTR for him or her. It can be a little bit challenging because, like I say, the experience of receiving ketamine is very different than your normal everyday experience, and by definition it's very hard to articulate this in the English language. I mean, that's just kind of how it is. But one of the analogies I give to patients, my more common analogy to have them sort of think about, is I have you try to imagine you're riding a motorcycle on the Pacific Coast Highway in California. Right, so you're riding down the street, this road to Malibu. You got the beautiful ocean on one side. You got all these gorgeous houses on the other side, and you're just cruising down the road on your motorcycle. The wind's blowing, and you're having a good time, right? You're wearing your helmet, of course, and all that. But the thing is, if you're going too slow, right? So the analogy here is if your dose is too low. If you're going too slow, then it's not going to work. I mean, a motorcycle has to go a certain speed in order just to stay up, and in California, people are going to start honking at you and carrying on if you're going too slow anyway, so it's just not going to be a very enjoyable experience. Now, if you're going too fast, meaning the dose is too high, then you're going to be weaving through traffic, white knuckling it, and carrying on. That's also not going to be an enjoyable experience. So that's not desirable either. What we're trying to find is that perfect space right in the middle where you're not too slow, not too fast, basically the dose is not too high, not too low, where you're just having a good experience, where you really feel like you have a mild sense of disconnection. You're able to really engage in a different paradigm of thought process than you normally do. And that's where it's a little bit tricky because, again, physicians and clinicians are so used to everything being weight-based. Oh, give me the milligrams per kilogram and that's going to be it. That's not it, dude. That's not how it works, man. This is a very individualized space that we have to find for every patient. So that's why it doesn't work to run this like an oil change shop, where everyone gets the same milligrams per kilogram over a certain amount of time and everything's good. So like I say, hopefully that explains it a little bit. Most patients, once they're done with the infusions, I ask them, hey, was I accurate? Did the motorcycle analogy work? Did any of my analogies work? And most of the time they say, you know what, you were close, but you really can't explain it in words, which is part of the idea. That's what we're trying to do with ketamine. Yeah, it is a powerful medication. This is a powerful experience, but again, we're trying to change the thought processes of some folks who have some very long-standing mood disorders and just having issues with the way they're processing things. One good example that I use a lot for my patients was given to me one of our patients who is a veteran. He was an infantryman in Iraq. And when he served overseas, he obviously has seen a number of very disturbing things, lived through some very challenging experiences. And he was dealing with a lot of anger issues, really had a lot of re-experiencing. His family was very, very concerned about his symptoms, especially his anger and just the way in which he kind of saw, interacted with his family and saw the world. And this particular gentleman, after about his third or fourth infusion, we were talking, and he gave a really good analogy that I like to use for a lot of folks, where he says, after I got back from Iraq, my whole world was kind of like when you live in an old Western movie. You're watching a Western, you think it's 1835, you see the horses and the gunslingers and the tavern and all just the stuff. You think that it's this old Western movie. But the reality is it's not a Western movie at all. It's a Hollywood set. There are food trucks, there are computers, there are lights, hairstylists, and you name it. And that is actually the reality of what's going on. So this particular individual felt that after the infusions, he was sort of seeing the world, seeing his paradigm in one way after Iraq, where it was, a certain way, and then he felt that, the experience of receiving the ketamine, the mild dissociative, the disconnective feelings that he had, helped him change his paradigm, the way he sort of saw Iraq, the way he sort of interacted with the world. He said to me that, for him now, Iraq was something he could sort of wrap up in 100-mile-an-hour tape, as we call it in the Army, and put it on the table. And then he was here, that was there. It would not necessarily erase the memories. It's not like it gets rid of all that, but definitely change his perspective on how he saw things. And he felt that change in perspective was vitally important. Another really cool example or analogy that one of my patients gave me as far as how the experiential quality works with ketamine, how the psychotropic therapeutic response kicks in, was a gentleman in his mid-20s we took care of who had quite a bit of sexual abuse as a child and a lot of trauma, psychological trauma as a result of this. He reported that for him, when he thought about his trauma, when he thought about the experiences he went through, it was kind of like he was in this box. He sort of had this box in front of him, and if he ever even looked at the box or thought about interacting with this box in any way, that it would basically he would just divert and start drinking alcohol. It was his method for dealing with that, and didn't want to engage with that in any way. For him, he felt that once we got his ketamine infusions to the appropriate level and got him to that PTR, he felt much more protected and safe in being able to deal with that box. He said it was kind of amazing in the sense that he was able to work with one of our therapists, and not only were they able to talk about the box, but they were able to open this box and take a look inside it and talk about what's going on. And for him, it sort of created this protective, psychic mental space that he could exist in and deal with issues and whatnot. And for him, that was an amazingly powerful experience, and really how he experienced what we call the PTR. Another patient gave me a really good analogy that I use a lot for the PTR and what it's like to exist in this space that we're talking about with ketamine. And that's where he described it, it's kind of like when a friend of yours is talking to you and says, hey, I'm having troubles with this and this is my job, my girlfriend, whatever the case may be. And to you as the friend, it makes a lot of sense. You can just easily say, hey, you ought to just do X, Y, and Z. Just, break up with her, do this, do that, change this. It makes so much sense. It's so easy for you to do that. But your friend, of course, is locked in a certain thought pattern, a certain paradigm where they're like, no, I can't do that. I'm sorry. It's just not working for me. So this patient of mine is saying, boy, he was always that friend who was locked into that thought pattern. And then while he was getting ketamine, while we helped him increase the dose and get to that PTR, he said, it's kind of weird because I could end up kind of being like my friend analyzing my situation. I could come up with ideas, and it wasn't necessarily me anymore thinking about them. So it was just kind of a very fascinating perspective, and he talked about how the change can be where you start thinking a little bit differently. You can see solutions in a different way, and that is another good example of what we think of as the PTR. So that's much more than just biochemistry. That's more than just hitting receptors and causing some synaptic connections. This is the paradigm of how these patients are seeing the world. Okay, thanks very much for watching this video. Hopefully we've done a halfway decent job of introducing you to what we call the Psychotropic Therapeutic Response, the PTR. Like I say, the experience for ketamine is very important in addition to all the biochemical changes. Please feel free to check out some of our other videos where a number of our patients have made testimonials talking about their experience. You can hear it in their own words as to how they processed this experience, how it affected them, and what it did for them. And if you're interested in becoming one of our patients, you want to learn more about what we do, if you're a referring clinician who is thinking about sending us one of your patients, feel free to give us a call. We'd be happy to talk to you, try to answer some questions about what we do. We have a number of other videos that you can see on our various social media channels. We've tried to really share with the world what our philosophy is on ketamine infusion therapy and the way we approach it and what we're all about. So feel free to contact us at the information listed below, and hope to talk to you soon. Thanks for your time.